Technology being showcased today is MastiSense, which is a low-cost on-farm reagent-free device for early mastitis detection. The lead inventor is Dr. Ankita Singh and the organization is MooRopan India Private Limited. Mastitis, as you know, is one of the most prevalent and costly diseases in dairy cattle, affecting both milk quality and animal health. It is basically a bacterial intramammary infection which leads to inflammation of the mammary glands, resulting in reduced milk yield and increased somatic cell count. The main challenge in detection of subclinical mastitis is that there are no visible symptoms, and because this disease is a multi-etiological disease, it is very time sensitive and early detection will lead to better recovery. There is a very high disease prevalence of subclinical mastitis, which affects almost 30 to 50% of animals in India, and it is causing a huge economic loss with global losses up to 20 to 30 billion annually, and indirect impact on the farmer is reduced milk yield, discarded milk, and treatment costs and culling of the animal. There are various methods and solutions available for picking up subclinical mastitis, so it is mainly about picking up the hidden infection before the visible symptoms appear. What are the traditional cow-side methods? That is the California mastitis test, electrical conductivity based test, and visual examination. These tests are on field, but they have a limit on the detection, almost up to 2 lakh somatic cell counts, and the laboratory based methods, that is a somatic cell count, bacteriological culture, PCR, and molecular diagnostics, which are very sensitive and have no limit to detection, but they are expensive and they require trained personnel. There is a huge market size and opportunity with the global market CAGR at a rate of 8.3%, and global mastitis diagnostic market is approximately USD 250 to 300 million in 2024 and is projected to reach up to 500 million by 2030. The factors driving the growth are the market is expanding rapidly due to the rising incidence, and also there is a growing awareness. There are various major global players in this market like Boehringer, Zoetis, Merck, Siva, Hipra, Virbac, etc. There are some limitations on the on-field solutions for detecting subclinical mastitis. So the California mastitis test which is available, the cost is low, around 20 to 30 rupees per test, but it has a detection limit of 2 lakh, and the main problem with it is it loses out on, that is on 25% of the false negatives, and it requires reagent mixing and visual interpretation. The Dremensky mastitis detector test, the cost is high, almost up to 25,000 to 40,000. There's a detection limit of almost less than 2 lakh, and it requires device handling and calibration, and again here the false negatives are approximately 25 to 35%. So what is the need is a highly sensitive, easy to operate farm side test which will catch all cases, especially of subclinical mastitis, before the disease progression takes place. So MastiSense is the technology. It is a portable electronic reagent-free screening device which is an on-farm detection test which detects mastitis at the subclinical level. This test is based on the electrical conductivity measurement of milk, and during mastitis the inflammation leads to a disruption in the blood milk barrier, leading to a leakage of ions into the milk, and this results in an increase in the milk conductivity which serves as a biomarker of the infection. So MastiSense has a calibrated multi-probe sensing device, and it has an embedded signal processing which captures these conductivity changes, and with its algorithm it converts it into an instant, easy to interpret digital output. So this is how the technology works. In the first step, it has to be directly you extract the milk from each teat into the 4 different cups, and at the press of a button you will get the instant results with the LED, the red light indicating infection. So at the end of this presentation, there is a video which we will play, which will help you to understand how this technology works better. What are the validation studies which were done? A sample size of 208 animals was used. Each animal was tracked using a unique ID, and they were tested by all the three methods, that is MastiSense, California Mastitis test and Dravinsky on day 1, followed by repeating testing on day 10, and all the on-field results were benchmarked against bacterial culture plating as a gold standard. The results showed that mastitis detects infection on day 1, while other methods are still missing the cases, and all these methods aligned by day 10, clearly demonstrating a superior early sensitivity and a substantial reduction in the false negatives. As you can see from the graph, that the mastitis got all the cases on day 1, which the other tests got only by day 10. So if we look at the competitive analysis, the mastitis has a one-time cost of 7,000. MastiSense has a one-time cost of 7,000 per unit. It has a detection limit greater than 2 lakh SCC. It is simple, farmer friendly, requires no training and calibration, and most importantly, from the sample of the 208 samples, it showed a sensitivity higher than the California Mastitis test and Dravinsky test, and has captured all the false negatives. So the value proposition is that it helps in early detection with better outcomes. At day 1, it detects all the cases of subclinical mastitis which other tests have missed. This enables timely intervention and reduces the disease progression. It has a high sensitivity and a low miss rate. It improves the farm economics, and there are 0 consumables which are required. Let us take a test case. If you were to assume a farm of 50 cows and testing done once in every 2 weeks, with MastiSense you would have to have a one-time investment of 7,000 rupees for the device with no additional cost, no milk and chemical wastage, and the cost would be the same as 500 tests with CMT, and the time taken would be 11 hours versus a CMT based test would require around 14 rupees per test, and the recurring cost would be 18,200 rupees per year, and the time taken would be 43 hours. So if you look at the differentiation matrix, you will see that MastiSense sits in the only quadrant that combines a low long-term cost with true early detection, making it fundamentally superior to the California Mastitis test. What is the current status of the technology? It is at a TRL 7. Currently, it is under validation by NDRI to verify it with the somatic cell counter and other technologies. They have evaluated more than 12,000 plus samples, and they have filed for a IP with a priority date of 2023. What does the team comprise of? Dr. Ankita Singh, who is the founder CEO. She is a former associate professor, and she is a PhD in microbiology with a postdoc experience and 20 years of teaching and R&D experience. She has mobilized more than 33 lakh worth of research projects, and her expertise is in microbial biofilm. Along with her is her teammate Mr. Aryan Donga, who is the co-founder and CTO. He is a BTech in AI and data science, and he drives the product development and technology strategy. They also have mentors like Dr. Dushyant Sharma from ICAR and Dr. Raghu Vishweshwaraya from NDRI. What are the next steps? The next phase involves working closely with the dairy ecosystem partners to conduct large-scale pilot deployments and to develop manufacturing processes and cost-efficient supply chains. So they are seeking for manufacturing readiness sourcing, contract manufacturing, and industry partners who are interested in piloting the product. These are some of the facility images, and for more information you can reach out to us at the following coordinates. Thank you.